Good evening, everyone. My name is Simiran Choudhary, and I'm delighted to welcome you all to today's special session titled Think Pink Act Now Screen, Fight, and Win, organized by Voice of Healthcare and proudly supported by Cadila Oncology to mark the occasion of International Women's Day 2025. As we celebrate the strength, resilience, and remarkable contribution of women across the globe, it's equally important to shed light on the critical health challenges faced by women, one of them being cancer. So, this session aims to emphasize the importance of early detection, routine screening, timely treatment, and creating widespread awareness to improve cancer survival rates among women. So, we are truly honored to have with us today Dr. Madhulika, Senior Clinical Oncologist and Radiation Oncologist at Kumaran Medical Center, a highly esteemed expert who has dedicated her career to cancer care, patient advocacy, and advancing treatment protocols. Through her work, she has not only saved lives but also transformed the way we approach cancer care, especially for women. Welcome to our show, ma'am.
Hi, Simran. Thanks for the introduction. So, I would like to say Happy Women's Day to all the stronger women out there. So, it's really proud for me to give a talk on cancer today. And I would also like to thank the Voice of Health and Cadila Oncology for giving me this opportunity.
Thank you so much, ma'am. It's a pleasure of ours. So, in today's session, we'll discuss early detection, breaking screening barriers, and advancements in cancer care, and how women can take charge of their health. So, our goal is to inspire awareness, encourage regular checkups, and reduce the fear of cancer. So, without any delay, I would like to start with my discussion. Ma'am, why is early detection so critical in improving cancer survival rates? So, if you can share any real life cases where early diagnosis have made a significant difference.
So when it comes to our country, we're always set as a low socioeconomic status country, and our literacy rate is very poor. So early detection is still a very big challenge for us, especially women. They find it very difficult to come out and represent their problems. So I would rather say if people are diagnosed at a very early stage, say stage one, we can give up to 90 to 99% success rate. But hardly we see women coming at this stage, so it's a very big challenge in a country like ours. So I have few patients who have detected a lump in the breast, especially say breast cancers are more common. So I would like to quote that as an example. So when they even see the lump, they're not bothered about it. They always take it as it's related to their menstrual cycles or to their milk or lactation, all those things. So they take a year or so until it grows bigger or it becomes very painful. And only then they come to us. So there is always a stigma attached to it, and women find it very difficult to come out with their problems. So I say early detection is very critical because as far as cancer treatment success is related to the stage of the disease. So the earlier the disease, the better the outcomes.
Thank you for that answer, ma'am. Ma'am, as we're talking about the prevention, so there are barriers between this before we move towards the prevention. So, what are the biggest barriers preventing women from undergoing regular screening, like mammograms, pap smear, or genetic testing? And how can we break these barriers, especially for rural or remote areas?
So, speaking about the barriers, it's mainly the lack of awareness. So, our people are not exposed to oncology or any early symptoms of malignancies. I would say it is mainly the literacy rate which we are linked to, because not all women know that this is related to malignancy. This is the first sign we should go get addressed ourselves or we should meet a physician. So, it's mainly the lack of awareness. And next thing is about the fear. So whenever I go for a screening camp or a awareness talk, women are finding it difficult to come out with their problems. They always fear, what if I say something, the doctor will address me with some tests. That she may say that it may be a different tumor or it may be a problem with me. So I don't want to go. I don't have problems with it now. Let it stay there like that. So it is the fear the women have, and also the cultural stigma. They always link cancers to their sins. So they always say, I have not done anything wrong. Why did I get malignancy? So it's a cultural stigma which is attached to. And also the limited healthcare access. Not everybody is having access to all the healthcare systems. I live in a tier one city, so I feel like most of the healthcare units are running a cancer units as well. So where we have mammograms and pap smears running around. But for most of the people who, it's a rural India, that's what we call. So they don't have access to the healthcare system. So as a solution, I would say It's a community outreach we have to do. It's not just sitting in a corporate hospital and trying to address the problem. It's the community we have to go and reach out to them. And also mobile screening units. Of late, we have a lot of um, um, trust programs or charity programs which are coming up with mobile screening units where we take a mammogram vehicle outside to the community and also a pap smear kit, and we educate them and want them to do this thing. And subsidized programs as well, because as a general term, oncology treatments are very costly. So they always think like when we go for the treatment, they drain out the pockets. That is what the people say. So when these things are the biggest barriers, I feel. So community outreach, mobile screening units, and subsidized programs, especially in the rural areas, might help us a lot.
Thank you so much, ma'am, for answering that question and uh, for awareing our audience about this. But despite of the all the technologies available, advancements are available for the screening of breast cancer or any other cancer, especially for women, there is this fear, or that why should we go for the screening? Whether it is for the prevention, and it might not get come out, the diagnosis comes clear, there's no cancer, but still there is many fear, the misinformation, the myths around their head. So many women fear cancer screening due to this thing. So how can healthcare professionals encourage routine checkups without causing that unnecessary anxiety amongst patients?
So when we say screening, people would definitely say, when I say screening mammogram for the age of from the age of 40 years, they say I don't have any problem. Why do you want to screen me? So I first make myself very clear, saying that screening is for a healthy population. That's for a normal people, not for somebody with the signs and symptoms. So I would like to emphasize them saying that screening is for a normal person. You do not have any signs or symptoms. That is when we start screening, and not when you have any lump or any swelling or any discharge. So when you have symptoms, it is not screening. So I would like to give them a clear and a fact-based education, saying that what screening does and when do we diagnose the disease. By screening, we are able to diagnose it at the earliest. And also, the people will come up with a lot of myths, saying that if I do a mammogram, if I have a disease, the disease may spread. Or if I do a biopsy, many people say if I do a surgery, it spreads all over my body. So I'll try to address the myths and make them understand what is actually the disease we are dealing with. And also, generally, any subsidiary programs are going on, I'll try to emphasize on the screening part, taking into account the community around there, and also the community leaders who usually lead them. So I'll try to first convince the leaders who are heading the communities. So if they are convinced, it's easy to go for a community reach. So it's really
Yes.
tough, but try to do it. So it should be a friendly and a supportive healthcare environment. So you should listen to people and then address them, because each individual is so different. They come out with very different questions, very different fears. So I would say it is like an individual challenge we have to meet with every normal people to make them go for a screening.
Said it right, ma'am. Every patient is different, so the approach needs to be a little different also. We know that family history might play a role in cancer detection. So, what role does family history play in determining women's cancer risk, and how can genetic testing help in this proactive healthcare?
So, a strong family history, say if more of the paternal or the maternal aunts have history of breast cancers and their children are also having breast cancers. So there is a criteria where we lay down, especially for breast and ovarian cancers, to see whether they are fit into the criteria, and we suggest them genetic testing. Because when we say genetic test, again it creates unnecessary anxiousness among the family members. So we have laid down a set of criteria, say 2 or 3 members have to be diagnosed at the very early stage. So if they fit into it, we suggest them a genetic testing. Especially there are few breast cancers which are associated with familial predisposition. So we tend to do a testing first on the patient. The patient is positive for a genetics, then we screen their family members. So that is how it goes. It starts with the patient. So if the patient turns to be positive for any genetic mutation, we then screen the family members. So the family members are screened well and above the age. Say if the first family member was affected by 50 years, we would like to screen the population in their family by say 40 years, 10 years earlier. So that is how we do it. We try to emphasize that there are a lot of surgeries which we do, which is called prophylaxis. So just because you were asking me, I would like to say even we do surgeries even before they get malignancies. I would like to quote Angelina Jolie this time, because it's called the Jolie effect. So many of us know Angelina Jolie. She's a famous Hollywood actress. So she had this genetic mutation. She was BRCA positive, and her sister and her mother were also positive. So she underwent a prophylactic mastectomy for the other breast and ovaries, and she, of course, she got it reconstructed. But this is an example where even surgeries are done for genetic predisposition even before people get cancer. So that is how advanced diseases, advanced treatments have come up.
Ma'am, like we're talking about advanced treatment, so what are some of the most promising breakthroughs in breast, cervical, or ovarian cancer treatment today that is very helpful?
So, cancer treatments are of three different types. So, first is surgery. So, now we've made a breakthrough by saying something called robotic surgery. So, what magical hands cannot do, the robotic hands are definitely doing, where the recovery rate is much quicker and we're able to access with the minimal openings, and we have a greater degree of freedom. So, I would say, I think you can see my hand. So, when we try to do surgery, it is only this much of rotation we can do. So it's only 180 degrees. We are restricted with that. But when people do robotic surgeries, they can do a 360 degrees rotation. That's how the robots have come into play. So that is with surgery. So when it comes to chemotherapy, there is something called targeted therapy. Now we are able to target only the genes which are in the tumors. So those are called targeted therapies or immunotherapies. We call this as precision medicines. And next thing is coming on to radiotherapy. So even we can treat a tumor which is even 1 or 2 in size in the brain by not affecting the other areas. So that is how the modern medicine has evolved, so that the side effects are much lesser and we are able to give a much larger efficacy, because we see people living longer now and we want them to have a good quality of life. So that's how these precision medicines have come across.
That's great, ma'am. And I believe these advancements are helping us a lot in treating the cancer patients, and the advancements for the prevention, that is the detection we normally talk about, is leading a way that we can imagine a cancer-free life, even if a person is detected with cancer. Like doctors always said, cancer is curable, so we don't need to fear about it. And because of the advancements, it's very much a kind of there's this ray of hope for the doctors as well as for the patients. So, ma'am, how are advancements in targeted therapies or immunotherapy and precision medicine reshaping the cancer care for women?
So, as said earlier, now we see a lot of patients getting cured or say in remission, living for longer times. So, what we are worried about is the long-term side effects of the cancer treatment. So, with these precision medicines, I would say the treatments are less toxic. So, the quality of life which the patient have, I would rather say it's quite normal as they were before. So, after cancer treatments, they become quite normal as they were before. So, I would say these medicines are actually reshaping the cancer patient's life. So, less toxic treatments are now available.
So, does genetic testing and personalized medicine help tailor treatment for individual patients? And are these options accessible to the average patients in India? Because the example you quoted for is the Angelina Jolie. I believe the kind of genetic testing is available could be costly and might not everyone could afford it. So, is it accessible for everyone?
No. As said, the tests are much more costly than the treatments, because the genetic testing itself costs around 1.5 to 2 lakhs, and also some certain genes we test, and based on that we also tailor made our therapies. But all these therapies, say precision medicine, targeted therapies, and immunotherapies, are very very costly. It usually costs in lakhs, so not all people are affordable to it. So what do we do is, if there is a family history, not always we patients who are affordable, we do a genetic testing. If not, at least we make them compliance or other family members to go for a screening, routine screening, and whenever they come with the patients for follow-ups, we also try to do a screening on the family members as well. So that is how we do it. Otherwise, it is very difficult because it's very costly, and not all genetic testings are available now in our country, especially.
Ma'am, since you also explained about us the costing and thing, so what do you think is the barrier that the government or the policy makers can, play the role that if this is very helpful for everyone, if detection can be done on time, and then if there's something there, doctors can plan their treatment accordingly. So what policy makers can do to make this more affordable and accessible?
I would rather take this as a tricky question as well, because now I think over the last 10 years of the hospital based registry, we feel like there are more number of cancer cases which are coming up, and the government is also having a look on these cases. So I think This year they have launched a cervical cancer vaccination, which is produced by the Indian Serum Vaccines, which is produced by India. So it is the more the medicines and more amount of centers should come up. So this time the budgeting has been done where there are more than 100 cancer hospitals coming up, especially in the rural areas. I think that is a very big step which we need. So we are moving towards what I say, a horizon where we'll see like every city at least has 2 or 3 cancer centers, and where all the patients are taking treatments there. And because most of these medicines are imported, especially our radiotherapy machines, which cost in crores, are all imported from Germany and US. So India is also making a radiotherapy machine which is affordable to most of the rural sites. I think we are in the pipeline in making uh, the oncology medicines and the treatments available for the rural areas. But it will take years to come. Maybe say next 10 years, we'll be fully equipped with all the uh, necessary things to treat the rural people as well.
Thank you so much, ma'am, for answering that question. And like you said, yes, government is playing a great role, and especially if you talk about this year's budget, so they are doing great. Like they made exemption free some medicines for the cancer treatment, tax free cancer medicines, and like you said, they're coming up with the cancer centers. So I think these are the small changes and steps that the government is making, take seeing the scenario of our country. Ma'am, how has the approach of to treating women's cancer has evolved over the past decades? And what are some of the biggest changes you have witnessed in the treatment protocols, if I have to ask?
So I would say because each individual is different, no matter it is for women or men. I would say each individual is different, and not everybody fits on to one treatment. So we are more evolved toward personalized treatments. So every individual is different, and every individual bears it. The tolerance to the treatment is also different, and how they respond to the treatment is also different. That is what I've learned. Because I have patients who are on stage one, maybe say 10 patients are stage one. Not all patients do respond the same. Some patients may have residual disease, some patients may come back with the disease, but I will not have an answer of why did they get back, why certain patients did not get it. So we are still in the learning curve. We are understanding a lot of prognostic factors which affect the disease, their remission, and things like that. I would say over the period of last 15 years I've been treating oncology patients, and every day I keep learning new things from each patient. And my treatment has more or less it has been like individual based treatment. So I have to decide whether this patient will go through, will the patient complete this treatment, taking into their financial constraints, the social factors, the psychological factors, the family support. All this plays a major role in treating the cancer patients. So I have evolved my treatment through like this.
That's great, ma'am. Ma'am, also like you deal with lots of patient every day, and you come across whatever they think, and they explain to you their worries and everything. So, if you could dispel one dangerous myth about cancer that women believe, and what it would be, or you have heard the most.
Okay, they'll say, why me? So the denial is
Okay.
always there. So why me? I don't drink, I don't smoke, I have not done anything wrong to any other people, I'm a very good person, why did I get it? So they always link cancer with sins. I have not done anything wrong, that is one thing. And next thing is they always feel like it is devil, that's all, it's all over, I got cancer, I cannot live anymore, I don't want to spend anymore. So they always think it is as a death sentence. So these are the two things which I commonly hear from people.
And if I have to know, how you counsel them?
Breaking the bad news itself is a very big thing, because for us, I usually spend an hour initially if I had to supposed to break the bad news. I had also been working in UK, so it's a totally different practice in India, because we have to break the bad news to the patients separately, to the kith and kin separately, and other set of kith and kin around. They'll come up the next day, their uncles, their aunts. So it's like a whole family of 10 to 15 members. When they hear the news, they are with you. So it also depends on how receptive they are and how understanding you are. First, I will try asking them. I will let them talk. So listening to them is the most important thing to establish a rapport. So you allow them to talk, let them pour out their emotions, and you have to very politely and understandingly make choices of your words, so that they mean that you are not faking and you are really listening to them. So that brings a very good rapport. Once you establish a rapport with the patient, then it is like it is very easy for them to understand whatever you are saying. So I will always give them a period of say 1 or 2 days for them to accept what has been going on, cross the denial phase and cross the anger phase, and then come back to me after maybe say 2 3 days to discuss about the treatment. So first day we don't discuss anything. We just break the bad news, which takes around 45 minutes to 1 hour for us to break the bad news based on their emotions. So if we spend that time rightly, I would rather say the patients will be very compliant for the treatment as well, and they will understand what you're saying, and they will definitely go through the treatment. If you don't spend enough time with them initially, that's all. They will go for doctor shopping or they will go for any alternative medicines. So the fault lies there. The initial time which you spend with the patient is very, very crucial. That is what I always try to do. So I'll try to put my new case appointments so that I'm fresh in the morning, and I'm also happy to listen to them, not at the end of the day, because even we are human beings, we get worn out at the end. So not no new patients after 4 or 5, because you may not be in a position to talk to them. So I always have new patients early in the morning. I try to cheer them up. I try to cry with them, meaning say I try to understand their emotions, run through their family background, financial checks, and everything, and then I propose the treatment. Not knowing their family social status and financial status, if you just say I'm going to give medicine for 1.5 lakhs, your radiation is going to cost 3 lakhs, no, nobody's going to turn up to me. So understanding the family and the patient is the first thing which we try to do, and then we try to talk about the treatment. So I think this is very crucial as a doctor.
Said it right, ma'am. It is very important to gain that trust so that they believe in that treatment process, and they actually feel that I believe it comes with the manifestation that we are going in right direction. Everything is working for our betterment and everything. And the better patient listen to you, it understands, and better they work with you for the treatment also. So I think that's very important what you mentioned. Also, ma'am, you mentioned about some patients come and say that we don't drink, we don't smoke. Why it is happening with me? So if you can shed light on some specific lifestyle factors that women overlook but significantly reduce their cancer risk.
So, as a general, to reduce the cancer risk, as everybody says, it's avoiding. So, avoiding tobacco and alcohol is the first thing which we always say. And next thing is, uh, as far as India is concerned, we don't give priority to our healthy weight. I would rather say 70% of our Indian population, 60 to 70%, are obese, especially the truncal obesity with lot of hormones pumped in. So I would say maintaining a healthy weight, so which should be seen as a social status. We always think as having a car or owning a house is a social status. I would rather say having a ideal healthy weight is what is supposed to be your social status. Then only you will have your self-respect. So try to maintain a healthy weight and eating a balanced diet. I would rather say now a lot of people are going on crash diets. So anything more than usual is not good. So I would say a well balanced diet and regular exercises. We don't give priority for exercises at all. We always say I'm working from 8 to 1. We are more proud of saying that I'm a workaholic, I work 24 hours a day, I'm very busy. No, that is not priority. So regular exercises and timely screening, we should be aware of what things are happening around. So these are the lifestyle changes which can make it, and women especially have to think that their health is more important when it is concerned to their family, because we take care of all the family members. So when we fall ill, there's nobody to take care of us. So it is us who have to be very vigilant and take care of our health. So any smaller symptoms or anything, we always have our family physicians. Not necessarily we have to walk into a corporate hospital. We can always think of our own family physician or a smaller clinic which is close by. Get yourself checked. So if there is nothing, we are happy. If there is something worried, yes, we can get it detected at the earliest. So that is what I would say. Any small illness which has been ailing for more than 2 to 3 weeks and which is not which is interfering with your regular work, it is better to get consulted with your general physicians. Yeah.
I believe yes, not to delay, but just to consult your doctor, even if you suspect anything, so
Hello.
that hello,
I'm sorry, I'm not able to hear you.
am I audible to you, ma'am? Hello, am I
Hello.
audible to you? Hello, am I audible to
Hello.
you, ma'am? Hello. Hello. Am I audible? Um,
Hello?
Dr. Madhulika, can you hear me?
Yeah, I'm now able to hear now. Yeah, yeah.
Yes. Great. So I think you said it right, that this lifestyle issues and everything which can be preventable, which we can lead to a good direction, better direction, we should head for that. But since we're also talking about the future, how we can make our future healthier, happier, and disease free. So it is also important to know about the advancements in cancer research. So do you see a future where some cancers become completely preventable or curable because of the research and studies and advancements which is coming up?
Yeah, I would say many people are even unaware of this because it has been available over the last few years. Especially, I would like to highlight on the cervical cancer vaccines. So, it has been available in the market for the last 4 or 5 years, and it has been especially given in many of the private hospitals and clinics. So, this is one type of cancer which is completely preventable. I would say the virus which is causing the cervical cancer is the cause for 80 to 90%. So, when we try to vaccinate against this virus, we can definitely prevent the cancer. This was one among the preventable cancers, I would say. And even I had a talk in the morning today. I had to visit a college where we saw adolescent to adulthood children, adolescents. Still, the awareness of this vaccine is not very much among them, and they always fear like, what if I take the vaccine if I get the disease? So there are a lot of myths associated with it. I would say this is one of the vaccine which has been time tested, and it has been extensively used abroad. And now even our government has brought in the own vaccines, and which is less of cost. I would say that rather 2,000. So 2,000 is not a very big amount for us. We spend a lot on clothes and jewels for especially for our girl children. So I would say 9 to 14 years of girls, they can have 2 doses of vaccines, and women 14 to 45, even married women, they can take a single dose, but the efficacy is going to be a little less after marriage. So 14 years and above, there are 3 doses. So hardly it costs around 10,000. We spend so much for all other stuffs. So if we could, this is one of the vaccine which we definitely have to take in our lifetime. Especially, we should protect our girl children from it. So we do so much of, we think we are protecting them from so many other things. And one important thing I would say is protecting them from cancer is also our responsibility. So I would advocate all mothers, please think about it and start thinking about vaccinating your children against HPV. And abroad, even we used to vaccinate male children. I, in fact, have vaccinated my son as well. So HPV is also for boy children.
You said it right, ma'am. This is one of the biggest misconception which I also learned from one of a session, that HPV is for both males and female. It is equally important for both the genders. So I think one awareness should be for this also, that it is not only important for females but for males as well. Ma'am, as we are coming to end of our this discussion, my last question would be: what advice would you give to women today to take their charge of their health, their cancer risk, and overall health?
I would, being a working mom, I would say working doctor, prioritize your health because you are more important to your family, and nobody can replace you. Your workplace can replace somebody with you. If you walk out of your any program or anything, there are always somebody who will be filling up your place. But your place at home as a healthy mother to take care of the family cannot be replaced. You are irreplaceable at that place. So I would say prioritize your health. So stay informed about the screening programs available, maintain a healthy lifestyle, seek a medical advice. If you feel sick, please don't postpone, because when others feel sick, we always try to seek advice, we try to treat them earliest. But when it comes to us, we always postpone. So don't postpone, no procrastination for your health. You are the center of your family. So take care of your health first.
Thank you so much, ma'am. As
Yeah.
this important day, we wanted to educate each and every female listener, woman listener out there, wanted to educate about their health, the importance of how they can prevent the cancer, or even if detected, there are many other ways which can cure it. So, thank you so much for sharing your valuable insights. It means a lot to us for giving your time on this special occasion. Thanks a lot, ma'am.
Thank you, Simran. It was a very good opportunity for me to connect with people. Thanks a lot. Looking forward for more. Thank you so much.
Thank you.